Assalamu alaikum. We'll pass to the third part of Chapter 10, Medicinal Drugs. At the end of the session, you will be able to define and classify anesthetics and give an example of each class, classify the general anesthetics and give an example of each type, identify the possible side effects and overdose effects of general anesthetics, identify the methods of application and the possible side effects of local anesthetics, define antacids, and give the brand name of some antacids. You have to prepare before start, as for every period, your pencil, papers, and your chemistry book. Long ago, patients preferred to die rather than to submit to operations. Do you know what was done to a patient before an operation? They used to bind the awake patient to the table with ropes or straps. His screams were disregarded, and if he struggled violently, his arms and legs are grasped. But nowadays, operations and surgery are not agonizing as before, thanks to anesthetics. But what are anesthetics? We took in the previous lesson that medicinal drugs are classified in different categories according to the function that they perform. So anesthetics are another class of medicinal drugs that produce anesthesia, which is a state of being unable to feel pain, heat, or cold. Anesthetics are classified into two types. They could be general anesthetics, which are reversible depressants of the central nervous system that produce a loss of sensation and consciousness. And by reversible depressant, we mean that once these substances are eliminated from the body, the central nervous system functions normally again. And we have the local anesthetics, which provide a temporary pain relief on localized regions of the body. They act directly on the nerve cell to block their ability to transmit impulses. General anesthetics could be inhaled or intravenous. Usually in operations, they use the two methods together. The side effects of general anesthetics are dose-related, and they include depression of respiratory drive and cardiovascular function, nausea and vomiting, while the overdose may lead to coma and death. Now, how are local anesthetics applied? Local anesthetics can be applied by injection close to the nerves to be blocked. Example, cocaine. Note that the substance used in the needle of the dentist isn't cocaine, but cocaine is an example of anesthetic used for local injection. Or they could be topically applied on the surface of the site to be treated. Example, ethyl chloride. The side effects of local anesthetics include tremor, restlessness, respiratory failure, general depression, and drowsiness. Now that we are done with anesthetics, let's move into a new category of medicinal drugs. But first, let's see how many of you have felt a burning in the top of their stomach after eating chili or a lot of acidic food. Well, if you have experienced this feeling, then you had what we call a heartburn, which is due to acid reflux. So acid reflux is a common condition that features a burning pain of the stomach known as heartburn in the lower chest area. The stomach contains hydrochloric acid, a strong acid that helps break down food and protect our body against pathogens such as bacteria. The lining of the stomach is specially adapted to protect it from the powerful acid, but the esophagus is not protected. When stomach acid passes to the esophagus, the food pipe, the symptoms of acid reflux are felt. To reduce these symptoms, we use a class of medicinal drugs called antacids. So antacids are substances used to treat problems caused by excessive gastric acid HCl, and it's used to relieve heartburn, indigestion, or an upset stomach. They do this because the chemicals in antacids are of basic nature, OH-, which will neutralize the excess acid in the stomach represented as H+, so neutralizing thus the effect of the acid. Antacids come in various brand names and are available as tablets and liquids. The most common ones are the milk of magnesia, Malox, and Reni. Now, let's pass to the diary. You have to read these pages of your book, study the summary sheet number 3, and solve exercise 2 of the second session 2016. Thank you for your listening.